Hi, I'm Mary Montricase, the director of the Wisconsin Public Health Hotlines. We operate two statewide hotlines based in La Crosse out of Gunderson Health System, Maternal and Child Health Hotline and Wisconsin First Step. And today we're going to focus our program for you on Wisconsin First Step. I've been very happy to be working with Terry Enters at the state office to arrange this short video and in-service today. We have a goal with the hotlines in 2014 of strengthening our ties with birth to three. You are one of the main referrals we give out to our callers, parents and providers alike. And your information has been in our database from the very start. So birth to three is a central referral for us. And we are hoping to work closely together with you this year to share information about Wisconsin First Step and how it can be of use to you and to the people that you work with. Two members of our staff are also part of this video. Amy Magnuson, a parent specialist, will be talking with you, and Teresa Halverson, a database specialist, will share information about our website. So at this point, I will turn it over to Amy.
Hi, my name is Amy Magnuson, and I'd like to tell you more about Wisconsin First Step. We are, in fact, a statewide hotline offered 24 hours a day, 7 days a week to any parents or providers of children and youth with special health care needs ages birth through 21. At Wisconsin First Step, we have an extensive database of resources that's available to any parent or provider via telephone, by calling and talking to one of our live representatives, or navigating independently on the website yourself, and Teresa will tell you about that later. At Wisconsin First Step, we do house the central directory for the Birth to Three program and early intervention for the state of Wisconsin. You might be asking, what kinds of special health care needs can I call Wisconsin First Step about? That may include, and I'll just give you some example, developmental delays, physical or developmental disabilities, maybe emotional and mental wellness, genetic disorders, any children without a diagnosis. It could even be a parent seeking counseling for behavior modifications or looking for some help with parenting skills. A parent specialist is available on the hotline from 8 a.m. to 4 p.m. Monday through Friday. Otherwise, 24/7 you can access the line, and other staff would answer the phone and speak to a person live. Take a message and say, a parent specialist can call you back if needed, and I'll help you right now. A parent specialist is a bachelor's degree or above professional that also is the parent of a child or children with special health care needs. I feel this is very important because as the parent of a child with special health care needs, a parent specialist has a genuine empathetic ear. We want to listen and then assess appropriate resources. Daily, we receive calls from parents and providers seeking to contact Birth to Three, and so we give those parents and providers the explanation for Birth to Three. I'd like to also tell you a little bit today about what kinds of calls that we take at Wisconsin First Step, why a parent or provider would phone us. As a parent specialist, I speak to parents and providers anywhere in the state, and some examples of calls that I might get could be maybe an RN in a pediatrician's office is with a parent and a child, and the doctor has referred the Birth to Three program. So then I would ask for the zip code, get the location of that particular parent and child, offer their local Birth to Three program. But I would also remind that RN in the office to have the parent call Wisconsin First Step. Maybe that parent is concerned that the child isn't saying a lot of words for an age, maybe another type of phone call I would get. So they haven't seen the doctor yet, but my child just isn't speaking the same amount of words as another child I know. Maybe I'd ask, did that child have an appointment with his or her pediatrician? And I would offer the Birth to Three program. Other than just the Birth to Three program and the explanation of what it is, I might also offer that parent, maybe they're still not going to call, they're not sure, the Developmental Milestones booklet provided by the CDC. And that has, tracking, birth through 5 years old. What would I be looking for my child's development in all the areas needed? There's also a free online ASQ3 questionnaire that's available through the Easter Seals Make the First Five Count campaign. And it's the same as the many doctors' offices use the ASQ3 questionnaire, Ages and Stages questionnaire that stands for, to determine, is there a concern, somewhat of a concern, with any kind of delays that a child might be having. And so the parent gets that reassurance from their own home via the questionnaire online. I might also offer websites such as Wisconsin Act Early Campaign website, and so that parent can look up, is there anything I should be looking into more? Maybe there's tips on how they can do something better to improve a developmental area. So even if there's no developmental concern at the time of a phone call, that parent now has some tools available to assess for themselves and make a call later if they need to. Another type of call I might receive could be a parent, maybe they have a 5-year-old child and a brand new diagnosis. Nothing's been wrong so far. So I might talk to that parent more and determine who made the assessment. Was it a school assessment? Was it the pediatrician? Maybe decide what other kinds of programs would be helpful for them to tap into. The county's program to offer the children's long-term support or family support programs. I might also offer and would offer the children and youth with special health care needs regional centers, so that parent has another regional contact to get information, to connect with another parent. I would maybe look into what other needs does this parent or child have. Do they need therapy providers? Does the parent need some extra support? And maybe on that initial call, the parent is just overwhelmed. I've gotten a new diagnosis, and they just want to share what that feels like. So I might give maybe a referral to the regional center and then maybe offer some mailing information. And can I call you back in a couple of weeks? Maybe after things sink in, they need more information, we can talk again. So important is that follow-up. Within 2 weeks of the initial call a parent or provider makes, we make a follow-up call, the parent specialists. Did the caller get in touch with a referral that we provided? And do they still have questions? Do you need more information? And at that point, we would determine mailing, more agency referrals, maybe advocacy. I called and left the agency a message and no one phoned me back. So we'd make sure either via 3-way phone call or getting the information we need, get them connected to the agency. Maybe it's research, something outside of, they contacted an agency, they're still waiting for an answer and they want it soon. We can maybe provide research or a contact person. I would also like to just mention that Wisconsin First Step, we're part of a larger network of services. The Children and Youth with Special Health Care Needs Regional Centers, ABC for Health, Parent to Parent, Family Voices. We have monthly information referral and collaborators calls with these agencies. We listen to webinars they may provide. We go to in-person events, and we keep in track with the e-newsletters that come so we can stay in the hub and give everyone the information they need as it comes through to us. So I'd like to wrap up now and offer it over to Teresa, who's going to tell you how to access and use our website and reach our database. Thanks.
Hi, I'm Teresa, and thanks for the opportunity to show you our online database and give you some basic ideas about how to use it to search for the resources that the kids and families you work with might need to support their development and growth. I'd like to just go right into it and show you the online database. So as we go from our main web page, here on the right, you would click on Search Our Database of Agencies and Organizations, and that will bring you to the opening page for searching. I'm just going to show you a few basic things. The first thing that you're directed to do is to enter the zip code, and I'm going to choose the zip code for our lovely community of Chippewa Falls in Wisconsin just for today's demonstration. Now you have a few different options for how you might want to search. On the right side of the screen, you have a couple of options. You can search by keyword. These would be your own phrases to describe the type of service you're looking for. I'd encourage you to keep that fairly short, 1 or 2 word phrases, things such as speech therapy, apnea monitor, child car seat. Those typically will get you the best result. Just below that on the right, you can search by agency or program name if you know the specific name that you're looking for. Examples might be Parent to Parent of Wisconsin, Wiseman Center, your own program, Birth to 3, or Katie Beckett. Then there is a third option that we've developed, a more guided search, and that is on the left. You'll see it says Browse Categories. And what we've done is we've developed some category listings that are specific to the types of services typically sought by providers and parents of children and youth with special healthcare needs. Also one for pregnant women and children. Today I'd just like to take a look at the children and youth with special needs category listing and go through step by step a search using that category listing. So you'd click on children and youth with special needs. That will open into a full listing of the various categories that we've developed that are available. And you can see it's quite extensive. We try to address all aspects of a child and family's life that might benefit from supportive resources. Things such as medical care, recreational activities, social, financial, advocacy, medical equipment, just to name a few of them. Each of these categories then will also open up into a subcategory listing, and these are more specific and they are your search terms. So you can see under developmental screenings, birth to 3, our primary referral, and then the more general developmental assessment, developmental screening. And each of these then would have that same subcategory listing. So now let's just do a quick search so you can see what that looks like. Say we would like to find resources for health check exams for a child in Chippewa County. You click on health check exams, and that will bring up a listing of the agencies offering that service in Chippewa County. A couple of things on your main list. They're organized by default by distance from the zip code or county that you entered. You can also take a look at where they are located by using the view map. It's a Google map screen that will come up, and they have the basic phone number and address information. Then if you click on the service itself, it provides you with much more detailed information about that service and how it's offered at that particular agency. In addition, you can see various other services that are offered by that agency. And finally, I'd like to just point out a couple of nice features about these results and how you might use them. First of all, if the agency has a website or an email, those are hot links, so you can go directly to that. And then the other two things I wanted to point out, you can print the results and offer them directly to a family in your office, or you can send those results to their cell phone as a text or to their email address. That's basically it in terms of searching. There are a few other features, and I would encourage you to take some time and go in and take a look. See how this resource might be useful to you and support you in your work as you assist families and children with their needs. So thanks again. It's been great to have an opportunity to show this resource to you.
Well, thank you all again for this opportunity to be part of your Birth to 3 regional meetings. We really appreciate this chance to share more information, and I hope you did pick up more about how we can be of help to you in your role as Birth to 3 staff, and also in spreading the word to the families that you work with. Terry Enters and I have worked on an effort to bring First Step flyers to these regional meetings and distribute them to all of you so that you have a supply ready to use as you meet with parents and families. So please join us in an effort to inform Wisconsin families about First Step. Your information continues to be key to our role. We refer to Birth to 3 all the time, as Amy mentioned, and we will continue to do that, and we really value our connection with you and with our other partners in Wisconsin. So thank you again, and have a great day.